Welcome to another episode of Ask FUH, and we recently concluded a wonderful workshop with more than 200 water birth enthusiasts across the city and who came from all across UAE to learn about water birth from the legendary Barbara Harper, who deals with gentle birth practices. So we have with us here today Dr. Jayacy, who is our consultant women's health and an acting head of department currently. So Dr. Jayacy, why don't you tell us more about what does water birth include and what is the concept of gentle birth? Because I hear that not only does it include normal birthing but also cesarean section as a gentle birth.
First of all, thank you for having me here today, Bhavna, and I'm happy to talk about this subject which is so close to my heart and which I'm so passionate about. There's a lot of change that's happening all over the world, and in our part of the world, we are still into the conservative births and when you compare to the Western world, but there again, it's been the parents or the couples who have come forth and made the change. So for me to experience water birth, to experience what we call as normal birth, for me, there's no normalcy in birth because of course we all consider birth as painful, it takes long time. So I would like to call it as a physiological birth because birth is natural, it's been happening through centuries. But then science came in, we stepped in, and of course science has made us progress through years because technology has changed the way we birth, better facilities. But then we stepped into something that was so physiological and we started changing it. And so now birth, when you get a patient coming to us, it's more associated with fear because they worry what was going to happen to them, what's going to happen to the baby. So that's what we are trying to promote here in Fakeeh, to help our couples, both the parent, because it's both the husband and the wife that's involved in this process, to get to understand birth as that's something that's physiological. So there are things that happen, but here, since you're in an institute, you're with the hospital, you're with the experts, we are there to deal with what comes as non-physiological. So education is very, very important. So here, I love the concept of water birth here because we are trying to get birth to its normalcy. So I hope we are able to move forward, and in the past 2 years, I think there's been a lot of progress in the water birth. The number of rates of patients coming here to birth with us has increased, especially seeking water birth. It's not just those patients who have experienced it before, but couples, young couples, they want to explore birth which is more normal.
So when it comes to a cesarean section, how would you say that it is also a gentle one? How do you ensure that it's a gentle one?
See, when you tell about cesarean section, there are a lot of things that are involved that we need to look into. What I call as a gentle cesarean, which I love promoting, is when we have time to prepare the couple. There is time. It's like a planned procedure because most of the times women or the family does not like the experience of cesarean because it's always an emergency where things change. We cannot understand who would have an emergency. So that's the time most of them reciprocate and they're not happy. But gentle cesarean, mostly we can have that approach when it's an elective. It's planned so that here we have a team with the OR team. We have a wonderful OR team supporting us with our midwifery unit and then the whole our RMO and the support unit. So it's planned, we plan a time, and it's more than a medicated cesarean. So we keep the rooms quiet, we hear what the mother needs to do. So we play the music they like, and there's dim lights, no sounds, no machines there. And so we want to get birth, not to get birth, to get the mother to experience birth as normal as possible. And that was possible, and we had a very great outcome because I could see even the outcome, the recovery for the mother and the baby was so, so wonderful. And when they come back, their postpartum recovery was so good. And here in natural C-sections or gentle cesareans, we see that the baby gets to spend time with the mother. So once I take the baby, I immediately get the baby to have the skin-to-skin contact. And if the parents wish, they can even see their babies being born. It's a little difficult because you need to enjoy this process because that's the whole point, Bhavna. The whole point starts with education. So when a woman comes to me asking for a gentle cesarean, I educate the couple because it's an understanding between the couple and me. Since I do not know the reasons for the previous birth, when I do the cesarean, a gentle cesarean could change. There could be things that could complicate in between. So they are willing to take that risk, and I'm willing to help them. And there have been cases where they've been very happy to watch the baby come out. And the most important moment for me is when I could hand over the baby to the mother, do the skin to skin, and they're so blessed and happy to have that experience.
That's lovely to see, doctor. And we'd seen those recent videos of people enjoying and playing the final countdown, and
it's amazing because I've seen what change we could bring to the newborn. Because being with the mother, getting the blood flow, doing a late cord clamping, and the outcome for the babies. Because whenever I've seen these normal births, or like I say, the physiological water births, or my gentle cesareans, these are the babies who've never had to go into an NICU. There could be variants, but what I experienced was, it was always a good outcome for both the couples, the family and the baby.
So would you say that, and you've been talking about education, and being a mother myself, I understand that no matter how much you educate yourself about birth, from the doctor, from the antenatal classes, from the net, from the apps that we get, it's never enough. It's a continuous process, and each individual has this unique birthing experience. How do you think that, or how do we ensure that each birth could be as comfortable for any parent to be, so that they don't have this entire overwhelming, because anyways there is a newborn who's gonna come, and usually we say it comes without a manual. We don't know what's gonna happen next.
Exactly.
So how do we prep for it beforehand, for the birth?
So what we need to starts with our consultations. So we need to make them realize that birth is normal, is physiological. I tell most of my patients, you don't have to ask your heart to beat. You cannot control your heart. Maybe I walk more, my heart beats more. The same thing accounts for your digestion. So birth is such that it's not in your control. So when birth happens, you need to be prepared for that physiology. For example, you have a headache. You need to take some medication. You need to take rest. So you have gastritis. What do? You change the way you eat. The same thing, when you're birthing, you need to change certain things. So everything starts with your fear. And so we start with making them aware that birth is natural, it's physiology. And so we have a very good program here in Fakeeh where we incorporate antenatal classes, introduce the couples to the midwives, get them exposed to those concepts of birth so that they can explore the different ways they need to birth. So the birth needs to be the mother's option. So there are a lot of my patients who are in awe of water births. There are certain people who are like, so it's the mother who makes the decision, so we cannot push them on. So here I always encourage all my patients to attend our classes because it's a beautiful class they have. So it helps even for the postpartum recovery because they look into the antenatal and the postpartum aspect, the breastfeeding, and we have beautiful lactation consultants here now. So it's been a pleasure to work with all of them because it's a team. It's not about a natural birth or a physiological birth or a gentle cesarean. It's a team that matters. So here we have built up the team and we are making it stronger, and it's a great journey for us now.
I think it's the joint team approach that also provides the overall experience that one has as compared to going just somewhere and okay, I know this doctor and then I know the facility, but everything 360 degrees available here from birth to beyond. The antenatal classes, and we have these wonderful mummy mornings where we keep meeting these people who have given birth here, and then seeing those children grow and then them getting into the next pregnancy. It's a wonderful experience to see the growth. I call the birth as the happiness in healthcare. It's one of the places where you see the happiness coming in. There is a lot of.
I usually tell most of my couples who have had and experienced this kind of births, which are more physiological water births, to open up, because still we have communities which are still not open to such ideas, because there are people who are scared, they would like medicated births, they would like to be monitored. So, but when they know that these things are possible in a hospital where you have every facility here,
Yes.
and we can deal with any emergency anytime.
Yeah.
So that's the whole concept of getting the mother fearless, because fear is a factor that runs and makes birth more complicated. So here in Fakeeh, we're building up a team, and we've already built up, and we want to grow. So we encourage more of our patients to come experience us here.
Yeah, and so I mean, Fakeeh Care as a group has also been very visionary, and when they brought this hospital up to the land of UAE, they invested in the unique labor delivery rooms where the admission is in the same room and you deliver in the same room. You don't need to move anywhere. It's so convenient as it sounds, and we have 8 water birthing suites also here. So if somebody is opting for water birth, there are usually a lot of misconceptions in the mind, how the birth will happen, how it's gonna be. Can you highlight 2-3 misconceptions that people have, and then that does not exist, like the mythbusters, I would say?
The biggest thing for so many, even for people, medical staffs, they still wonder. I've had questions from staffs who are not related to our department asking, "Doctor, what about the baby? When the baby comes out, will the baby breathe in water?" So that's the biggest misconception I should say they have, because people think that when the baby comes to the water, they breathe and they're going to get suffocated and all that. So we have the natural mechanism where, your lungs are quiescent, it's sleeping. So womb is filled with water. So when you're in the water, when you birth in water, you're getting the baby into the normal physiology of its space it was occupying. So till the baby comes out into land or air, the baby doesn't take its first breath. And under the water, as long as the baby is attached to the placenta, as long as you have an umbilical cord, you have the functioning of the placenta, the baby gets the first nourishment from the placenta. That's why now we are very much into late cord clamping. The last births which we had in water, we had the cords clamped so late as to 7 minutes, because now we wait for the pulsation, and when the pulsation stops, we clamp. Because like Barbara was mentioning in her classes, it's a live organ. If there's an issue, of course we cut, but if there is no, why can't we wait? And I was amazed that in the last 2 births which I had, it was still pulsating for more than 7 minutes. And it was an amazing journey when you have these kind of exposures, but you need to be more fluent in these things, and the whole point is about the patient preparation, the couple preparation, and to have an understanding with their own physician.
Yes, I think that resolves that's the master of the misconceptions that everybody has. And
the baby breathes underwater.
Yes, and it's so amazing. Some people also, I've heard that people say the babies are natural swimmers, so they would swim.
Exactly.
Thank you for clearing that myth, and thank you for educating us today more about it. I'm sure we can do more and more of this and keep talking about birth.
Yeah, if you start asking me about birth, the natural, I call it physiological, because when we say natural birth, maybe we give the wrong idea of, there is no pain involved, there is no preparation involved. Yes, we need to prepare. Like I said, if you fall sick, you need to prepare. So the same way, you are given 10 months to prepare for that day. So once we take you to the journey, so like I told you about, now we have this Fakeeh, the classes and the team here, where we take these mothers through the journey. I should say the couple through the journey, because the husband is the biggest partner for them, because birth support. So once you have these kind of experience, then you start looking forward to that kind of birth. When couples come late to me, sometimes they feel a little difficult, because when I start talking about natural, which they've never heard about, because this was a thing that came to my mind because we were coming for this conversation today, that even when I was doing my master's, I've never experienced a natural birth, because any mother comes, even in labor, we start putting in a cannula, we start making a push. So this was a slow change even for me, because when you start listening to your patients and you see them talking about others, then I started thinking, do I want to be that obstetrician? Because I always believe that I'm the first doctor for that unborn child, and that experience really matters for the mother. So that slow change has progressed me here, and Fakeeh was a place that I could grow, because I saw all these rooms with this amazing water tubs, and I was like, where could I get this experience? So here we are at Faqih, trying to move on, getting birth more naturalized. There could be changes, but we educate our patients through our antenatal classes, and the whole team helps.
Thank you, Dr. Jayacy. That really was very insightful, and I think birth is becoming more and more conscious, as I would like to say, and we are connecting to our roots, as well as we are using the latest of the technology to do everything possible to make it as natural as it is, whether it's a normal vaginal birth or whether it's a C-section. And thank you so much to you and your team for facilitating that in the healthcare environment. Thank you so much again.
Thank you for having me here today. Thank you.